Hello and many thanks for joining us on the program People, Politics and Power. I am Iwoni Amarere. Now, in line with our people-centered programming, we are turning our attention on this edition to the health sector in Nigeria. There's absolutely no doubt that the healthcare system in Nigeria is in a parlous state. This has been attested to by several independent reports and even by government institutions and functionaries themselves. The poor governance system in this sector, as in many other sectors, is legendary and has a direct nexus or correlation with the country's Human Development Index because it negatively impacts the people's poverty situation. A new report on the state of primary healthcare delivery in Nigeria, undertaken by an international non-governmental organization, One Campaign, which is a global body advocating to end extreme and preventable diseases, shows clearly that the outlook of the health system in Nigeria is grim. The report specifically focuses on the Basic Healthcare Provision Fund, which was set up to address the gaps in primary healthcare solutions in Nigeria. It evaluates all 36 states and the Federal Capital Territory, FCT, based on enabling legal and policy environments for health and health planning, health financing, human resources, health products and technologies, health management information, service delivery, and community involvement. The study found that the health outcomes in all the states are poor, thereby creating a human crisis. The study analyzes and ranks health systems' performance in the 36 states and the FCT using a select group of 20 indicators, cutting across inputs, processes, and outcomes. The findings of the study showed, for instance, that Zamfara State is the worst state in Nigeria to be a citizen in need of health care, while the FCT is the best place to get access to health care services. Now, however, the entire system continues to underperform as Nigeria ranks very poorly in preventable maternal and child deaths compared with even poorer countries of the world. Now, we are joined on the program today by the country director of One Campaign. Like I said earlier, One Campaign is a global body advocating to end extreme poverty and preventable diseases. The country director is Mr. Stanley Achonu. Mr. Achonu, thank you so much.
Thank you for having me.
Right. Okay, we'll delve into our discussion when we return from this very short break. Stay with us. All right, thank you so much for staying with us. Mr. Achonu, welcome once again. Before we delve into the assessment and the outcome of that assessment, tell us a little bit about One Campaign and why it decided to carry out this study.
As you mentioned, One Campaign is a global body campaigning to end extreme poverty, founded by Bono, the very popular rock musician who used to host debt relief campaign around the world and substantially did work here in Nigeria around Nigeria's debt cancellation when Okonjo-Iweala was Minister of Finance and were campaigning to cancel Nigeria's foreign debts. Our work around the world with G7 and global leaders, asking them to support poorer countries to lift them out of poverty. Here in Nigeria, we started a campaign called Make Nigeria Stronger, which is focused on basic primary healthcare service delivery. Again, remember, we are focused on ending extreme poverty and preventable diseases. And health outcomes contribute to people's ability to move out of the poverty bracket. Not poverty, extreme poverty bracket, because there's a clear difference, and I like to distinguish, there's a clear difference between just being poor and being in extreme poverty. And a bulk of the Nigerian population is in the extreme poverty bracket, right? So what we have found is that there are just few things that get people out of the extreme poverty bracket. When you provide universal basic healthcare coverage through services offered at the basic primary healthcare centers, offering primary education to people, right? Those are some of the building blocks that move people out of extreme poverty into not so pleasant, but into the poverty bracket, because they are clearly too different. So since 2018, we have been working on basic healthcare provision fund when after the Nigeria Health Act was passed. The law was passed, but nobody implemented this component that provides funding to the basic healthcare. And we recognize that this is an important building block to health improvement. So we started the campaign to get the federal government to fund, to provide funding to the BHCPF. In 2018, for the first time, budgetary provision was made. And we did a lot of work, protest at the National Assembly, blocking the gates of National Assembly, educating legislators who passed the law but were unaware that there is a component of that law that says this fund must be provided directly to the primary healthcare centers. The fund, just a minute, the fund is unique because it is not a bulk sum given to the states. The fund is disbursed directly to the primary healthcare centers to meet basic needs like drug stocking, training of staff, facility maintenance, and all of those things. So it was a little tricky. Once the federal government agreed to provide the funding, there were clear rules set up in the law that you must open a bank account for every primary health care center so that the money goes directly to the primary health care centers. But the states failed on their part to do what was required. So we spent another 2-3 years working with national primary health care development agencies and all the other federal agencies involved in managing the fund to get the states to do what is necessary. And most of the states are now at that stage where some of their primary health care centers, some of their health facilities now have their account to draw funding. And we thought that it is important, as money is now flowing to those primary health care centers, to beam light on the quality of service, but also to identify gaps that currently exist so that all stakeholders can work together to plug those gaps. And the report is important because partners who support basic healthcare provision and basic healthcare service delivery in the country, WHO, UNICEF, Gates Foundation, Clinton Health Initiative, and all those people spend substantial amount of money supporting, and Dangote Foundation spend substantial amount of money supporting government to improve quality of healthcare service. But we thought that it is important to bring all of the things that make quality healthcare service, right? It's not building, it's not shiny building, it's not new building, it's not just only the equipment that make a primary healthcare center. As we have seen, and when you follow constituency projects, they're always building primary healthcare centers. When you go to those primary healthcare centers, sometimes with equipment is under lock and key because there's no staffing, there's no plan on how to run a sustainable system, because it's not enough to open the door. The drug has to be available. You need to provide power, water, midwives, and all of those people, and doctors who come in once in a while to attend to patients. So it's beyond a shiny building. So we thought it's important to do a comprehensive review that shows what makes a standard primary health care service and where are we in each state in terms of providing this quality service. A lot of the data drawn from government is also important to mention that.
Stanley, there's so much to talk about with what we are put on the ground. First, there was a delay in putting down the legal building blocks.
Yes.
When it was done, not many of those who even passed the law were aware of what it provided. And then the funding came in, delayed, and with the funds there, they were not transmitted to those who needed them.
Yes.
At the primary health centers or primary health care level. It's no secret that the primary health care system in Nigeria is not a functional one. Functional in the sense that, like you have rightly pointed out, in many places, structures don't exist. Even where they exist, there are no personnel, human resources, and in fact, the equipment, the drugs to put them into proper use. Now, so tell us what the findings, the details of the findings of this your assessment, because you did an assessment of the primary healthcare system in all 36 states
Yes.
and the FCT.
Yes.
And one of the conclusions you came to was that you were able to determine which of the states has
better
outcomes, and that which has less
outcome,
than worse outcomes.
Yes. As you mentioned in your opening, the best place, if you live in a FCT and you use the primary healthcare service here in the FCT, you will get the best that there is available. So whatever the best is you experience in FCT is the best you can find in the country.
Even when we have communities in the FCT that do not have, in fact, they have to travel several miles to get to the next primary healthcare center.
If the experience
it is in the federal capital territory.
If the experience you describe is the best service, that is what I'm saying. So it gives you a clearer picture of what we have found across the country. The worst place to try to get access to primary healthcare center is Zamfara. And there are a couple of other states that fall within that bracket. Sokoto, Taraba, Kebbi are all at the bottom of the food chain. The best places, aside from FCT, N.G.O's service is also considerably on the upside. Anambra, Ekiti, Delta, Lagos, those are the places where the quality of service delivery. In fact, Lagos has sort of concerted effort. They are not the best, but you will see that there are concerted efforts to sort of provide the basic healthcare service, to poorer people. The challenge a lot of times is and outline some of them. Political support to implement this. Sometimes you have some of the human resources required, but the political support to mobilize and galvanize and show leadership for what you want is lacking in a lot of the states. The other thing we found is also funding. Of course, funding is extremely critical, and it was surprising that in the face of what we saw with COVID-19, and primary healthcare is important because if there is a disease outbreak in any community, the first way to detect it is from primary healthcare centers, because that's the first place anybody who falls sick goes to before they start to think of general hospital and tertiary institutions. So it's extremely important for disease detection, right? So what we found was that we thought that COVID-19 would have spurred states to look critically at this foundational basis. Even vaccine distribution is built on the back of primary health care. All sorts of vaccine distribution is built on the back of primary health care. But the funding did not show any political interest, because when you measure somebody's interest based on where they are putting their money in, the states were found lacking. Most of them did not invest up to 15%, even despite their commitment post-COVID to invest at least 15% of their budget to health. They failed at that, right? There is also something called, this is also tied to money, training and capacity building for workforce, midwives, because there are no...
Where they exist.
Yes, where they exist, yes. There are not enough doctors to man all of these hospitals, and they can do rotational shift, but you need to have midwives and nurses who are constantly available at the primary healthcare centers. The result shows that a lot of these people, in fact, one aspect of this report, lying with what the National Primary Healthcare Development Agency and the National Health Insurance Scheme, now authority, are supposed to do, is to identify all health facilities per ward and then provide funding for them. For most of the states, and this is not, and I need to clarify, this is not the responsibility of the National Primary Healthcare Development Agency or the NHIs. This is the responsibility of the states, right? And I must contextualize that what you get from the federal is support. What you get from NHIS and National Primary Healthcare Development Agency is a complementary support. And the states are supposed to provide counterpart funding to be able to assess this. In most of the states, it is only on paper, written on paper, that will provide counterpart funding. The funds are never released, right? So the challenges are so many, tax shifting, rotation of staff, availability, minimum service package, operational plan. These are basic things that helps the states plan for quality healthcare service delivery. Is lacking. even when officials of the states, and because we did talk to a lot of the state commissioners of health, even when they understand what needs to be done and are open to doing it, the political support needed to do it is not existing. So I think for me, first, I put the challenges we have found squarely at the footsteps of the governors who run the states, who have failed to provide leadership for quality healthcare. And it falls down to not prioritizing healthcare for the poor, because from time to time they provide all of those facilities that take care of the middle class. But for the poor, they are not prioritizing their need in the way that urgently needs their attention.
This assessment used 20 indicators.
Yes.
We have talked about some of them.
Yeah.
We have talked about the budgetary commitments, talked about the status of health legislation. But I also understand that in that regard, some of the states are still lagging behind.
Oh, yeah.
In terms of health legislation
And
in
policies.
these places and policies. And then, of course, the strength of strategic and operational planning for health in states. Take us through some of the other indicators.
So on legislation, the National Health Act is the umbrella legislation for quality of healthcare delivery in Nigeria. States are supposed to draw specific legislations and policies off that plan. For a lot of the states, the legal framework are so outdated that they're not relevant to today's world in terms of delivery of healthcare to the poor. So just providing legal framework for it, most of the states were found wanting. The other aspect is operational plan, because when you have legislation, you have to have a plan to implement it. On operational planning, the states end their planning at budget level. It doesn't go beyond that. And even when they have managed to put together a plan with support from partners like Gates Foundation and WHO and the rest of them, operationalizing that plan has become also a big challenge. And the report clearly identified states that are lacking. Some other states are investing heavily in infrastructure without supporting training, midwife training and all of that, and tax shifting. All of these components are already clearly outlined in the National Health Act, and they are not, the states are not pushing that. One other aspect of this finding is in terms of health facilities. And I did speak to a couple of commissioners who complained that...
That's state commissioners of health.
Yes, state commissioners of health who complained that based on federal government database maintained by the Federal Ministry of Health, on which some of these indices are calculated, that there are non-existent health facilities still on record, which then affect their ability to effectively plan, right? And this is the responsibility of the federal government. And we're going to engage the Federal Ministry of Health on these complaints. And, these are some of the challenges we want to be able to remove. Because, for instance, in a state like, I'll use, for instance, N.G.O, where if you have listed 400 health facilities, maybe 200 no longer exist. They've closed down. And these health facilities include private healthcare or state government owned. But some of them are clearly non-existent. But the requirement is for them to plan based on what is in the database. And all indices for the state is measured against that database, which does not provide accurate situation of things. Which means that from beginning of planning, you have already failed because you are planning on a false basis. In a place like Zamfara, question was asked, why are they in this poor state? Is it security challenge? Is it inability to attract staff? So these are some of the things we need to interrogate, because until you take a holistic view of why is a state in this form, and why is another state performing better, right? So Zamfara is not the worst hit in terms of security. You would think that if security is the reason for poor performance, Borno should be there, right? But from the ranking, Borno is not the least. Is close to the bottom, but is number 5 from the bottom, right? You still have states like Taraba, Kebbi, who fall below. You have Kogi, who is not exactly challenged security-wise. So what is the reason for the state of service delivery in this place? And we try to interrogate all of this. Our hope is not to make anybody look bad with this report. It's just to help the states think critically. What are we doing with minimum service package, right? How are we providing for this is important. For health, some of the health facilities, the drugs available are expired drugs. So drug stocking stocking of drugs in the primary health care center is a challenge. And when we did field work and asked some of these health facilities, why don't you get rid of the expired drug? They said that is the only drug available.
But they are expired, and they continue to dispense them. Is that not further endangering the health of the people that they attend to?
They have to keep something in stock. So, and for those of us who live in the city, we can go and say, please give me the prescription, I'll find somewhere to buy the drugs. In some of these rural communities, and we're talking about facilities available in all the wards across the country, there is no pharmacy to even go get prescription from. So the situation is dire. But there is opportunity to turn things around.
Which of course brings me to the recommendations that your report has put forward. What are those critical recommendations? What are those critical steps that must be taken to reverse this very grim situation that you described?
And I'll start with the states. For the states, a revision of their entire legal framework is needed. And we were very specific for each state. When you look at the report to be launched tomorrow and be available online, if you look at specific states, some have legal framework, no policy guideline for implementation. So we are very clear in terms of what they need to do. They are what we have listed as quick wins, and hoping that by next year, when the second version of this report comes, I will be very clear on the quick wins related to legal. There is one that they can do starting from January of next year, which is funding. They can commit to dedicating the required funding, especially counterpart funding. A lot of partners are willing to commit funding to improving health at the primary health level if government can match their counterpart funding. At federal level, there is the 1% consolidated revenue of federation that should go to the fund. Even though that 1% is provided for in the federal budget, the release is from the Accountant General's office, is not up to that stated amount, right? There are 3 gateways under the Basic Healthcare Provision Fund. There is the National Primary Healthcare Development Gateway, there is National Health Insurance Gateway, and there is the Emergency Gateway housed in the Federal Ministry of Health. That gateway is non-operational. The best performing of these 3 gateways is the National Primary Healthcare Development Agency. They are far ahead when you compare the 3 of them. And we have listed specific things for them to do. Provide additional technical support to the states, help states set up basic laws that they need, provide training and staffing needs. These things are clearly all defined in the report with clear specific steps on by which all actors, because this also affects the federal, by which all actors can help improve the situation.
Well, Mr. Stanley, a lot is packed in this report, which you say. I've only seen...
It's 200 pages.
Yes, I've only seen the executive summary of this report. And so I'm not in a position to delve into it in detail. But this report or this assessment also deals with issues of malnutrition. It deals with mortality rate, child and
stunting growth,
women mortality rate, and it seems to corroborate a report that was put out not too long ago by UNICEF and the World Health Organization about malnutrition in Nigeria.
A big challenge.
All right. So when we return from this break, in the second segment of the program, after the break that is, we shall be looking at yet another report, and that's the report I'm talking about, this time by UNICEF and the World Health Organization, WHO, which ranks Nigeria first in Africa and second in the world among countries with malnutrition cases. Now, this time we shall be joined by a public health specialist, Dr. Ifeanyi Nsofo, a senior New Voices Fellow, Aspen Institute, Washington, D.C. Right after the break. Stay with us. Thank you so much for staying with us. Well, according to UNICEF and the WHO, Nigeria leads in Africa and second in the world among countries with the worst malnutrition cases. Very disturbing, indeed. And according to that report, which was published in 2021, titled Fed to Fail, Nigeria has 17 million undernourished children. And of course, there are other aspects of this malnourishment that would shock you when you read the details. Well, we're joined via Zoom at the moment by Dr. Ifeanyi Nsofo. Dr. Nsofo is a public health physician and senior New Voices Fellow at the Aspen Institute in Washington, D.C. Dr. Nsofo, thank you so much for joining us.
Thank you. It's a pleasure to be here.
Great to have you. Now, this report by UNICEF and the WHO, to say the least, very disturbing for a country as rich and as well endowed as Nigeria. What's your immediate reaction to that report? Side by side with this report that one campaign has just or is about to unveil.
Okay, thank you for having me. I mean, I don't know what the network has a problem. I really couldn't hear you very well. But what I heard was, my reaction to the report that shows, so many millions of Nigerian children undernourished.
You are right.
Okay. Well, so it's unfortunately it's not surprising because this malnutrition status of under 5 children has been around for such a long time. It's not a new thing. It's just that the report obviously has tried to unpack and provide, accurate data for us to use for policy and for advocacy. And of course, 2020 with the advent of COVID-19, that also worsened, overall social indices for people, across the world, and especially in low and middle income countries, such as Nigeria. So it's unfortunate, but I also think there's an opportunity there for us, to do the right things to begin to reverse the adverse effects of, so many malnourished children in the country.
The report speaks of 1 in 3 children in the country being diminutive and 1 in 10 children wasted. Well, what does that really mean when you say wasted?
Okay, so wasted means that these children are so thin, for their weight, which simply means that they've not been eating nutritious meals. So when you see them, they look malnourished, they're emaciated. And obviously, another side of it, which is even worse than wasting, is stunting. Stunting means that this child, has is shorter than children, of his or her age. And stunting has more severe consequences on the ability of children to do well later in life. So it affects the cognition of children. But having said that, wasting is obviously what you see first in a child that is undernourished. And if that is not addressed as quickly as possible, it eventually would progress to stunting. And the unfortunate thing is that stunting is irreversible. And if you look at data further, you see that stunting in Nigeria is actually worse in the northwest of Nigeria. About 57% of children that are under 5 years in northwest Nigeria are stunted. Kebbi has the worst indices. 66% of children in Kebbi State are stunted, which means that they are not just malnourished, but their cognition is so poor that they are not doing well in school. And what that means that they will not do well as adults because they don't comprehend as well as children who are not stunted. And that has far-reaching consequences for us as a people, economically as well as socially.
Okay, let me bring in Mr. Achonu here in the studio, because this report that's just released, among the 20 indicators, you have about 4 or 5 of them that talks about proportion of children who are underweight, which often reflects acute malnutrition, proportion of children who are stunted, which often reflects chronic malnutrition, proportion of pregnant women who receive antenatal care from a skilled provider, proportion of pregnant women whose babies are delivered by a skilled provider, and proportion of married women whose needs to delay, space, or limit the number of children that they have is not met. Which means that this your report actually aligns with what UNICEF and the WHO is talking about.
And the report, the reason we added this part of the methodology to our report is because the services offered at the primary health care centers are supposed to help advise mothers on issues like this. This is where mothers go for the care they need during pregnancy and through child growth. It's obvious that, of course, once the building block of the primary health care center has failed, the result is what you are now seeing in the report highlighted. And as our report also found, these numbers are, accurate. It's no longer just, of course, you cannot debate experts at WHO and UNICEF. This is what they do for a living. And they did, we did consult them in preparing our own findings as well. It's correlated. And the thing is that government is aware. You don't need to enlighten those who already know these things. The numbers are there. The governors are also aware. They know. The reason it seems like this is new, and as Dr. Nsofo mentioned, is that we are discussing it now. It's not new. There are previous reports highlighting the challenges with malnutrition, with stunting, and all the rest of them, especially in the States. And look at the numbers. You see the numbers of stunting, underweight, malnutrition are also heavily in the regions where you find poor health outcomes and poor quality of healthcare delivery. And this is why, as an organization, we recognize that extreme poverty is directly linked to health delivery. And it's funny that the two reports are sort of saying the same outcome. If you look at the state, a place like Adamawa, you have 39% of children suffering from stunting, which is an outrageous number. How many kids do you have that out of every 100, 39 of them are suffering from challenges of malnutrition, underweight, stunting, and all of those things? It tells you that in another 15 years, you're going to have children who are permanently disabled because basic things of child growth were not put in place.
Particularly mental disablement.
Yes.
Dr. Nsofo.
And
yes.
their ability to read and write. Remember, that's
what I mean when I talk about mental disability and all of that. But Dr. Nsofo, now, if you look at the 2018 National Demography Health Survey, that survey says that 37% of Nigerian children aged between 0 to 59 months are stunted. That's a massive number. And of course, 7% are wasted, as you put it, people who are thin for their age. 22% are underweight, and 2% are overweight, that is heavy for their height. Now, what is the overall implication of this for a population like Nigeria? Because the report goes down to break down region by region what some of these figures are like. Okay.
So I mean the implication, the overall implication of this very poor nutrition indices are really far-reaching and long-lasting. Especially when the child has stunting. And I had mentioned that the data I quoted initially is actually from the 2018 National Demographic and Health Survey, that in Nigeria, 57% of children under 5, that children 0 to 59 months, are stunted in the northwest. Kebbi State has the highest population, and for you to understand, Kebbi State has the highest population of stunted children in Nigeria. 66% of children 0 to 5 years. For you to know the implication of that, if you look at a population, 20% of the population make up children under 5 years. So that gives you an idea. So if Kebbi, for instance, I can't remember the population, let's assume Kebbi has a population of 2 million people. 20% of 2 million people is about 400,000 children are stunted. 400,000 children, their future essentially has been destroyed because stunting is irreversible. So for me, that is something that has been of a concern. as far back as I can remember. And that is why it's very important for state governments and local councils to take responsibility. Because I know that most times people try to, share responsibility for healthcare to the federal government. But Nigeria is a federation. Health is on the concurrent list. So state governments, local councils must begin to invest. I like what Stanley said about primary healthcare and, the human resources for that to be able to provide these services. But also using those human resources in primary healthcare councils to educate communities on using locally available foods to prepare nutritious meals for their children, ensuring that women who just gave birth will do exclusive breastfeeding. Because these are basic things that we can do for ourselves, and not all the time having state and local councils depending on the federal government or international partners, to provide, support for these issues.
Now, Dr. Nsofo, this my next question will be for both you and Stanley here in the studio. Now, what from your studies and findings, what do you think is primarily responsible for these poor health outcomes? In the north, for instance, could we say is the insecurity in that region, or of course poor governance in some of these states, the lack of political will or whatever it is that contributes to having these poor outcomes?
Yeah. So, I mean, you're right, governance, insecurity, and like Achebe said, everything rises and falls on leadership. Over the years, leadership in this, whether it's leadership at the state level, local councils, community levels, have really failed, to get people to do the right things. Remember, this nutrition data are primarily focused on women of childbearing age, as well as on the 5 children. And what is commonly said is that, the very important aspect of life is within the first 1,000 days of a child's, life, from conception until the child is 2 years old. It's very important because what it means is that from conception, when the woman gets pregnant, the woman has to eat nutritious meals. Because when she eats nutritious meals, it simply means that, her pregnancy will do well, and the baby in the womb would also do well. After that child is born, until that child is 2 years old, the child should be, breastfed, exclusive breastfeeding within the first 6 months, and of course, introducing complementary feeds until the child is 2 years old. And this shows you why it is important that, we have policies that are targeting women, women of childbearing age, which is women from 15 years to 45 years old. Make sure they eat well, make sure that, they are properly taken, make sure they have access to healthcare, and that's why for me, it is very, very important for us to put these things squarely on leadership, on governance. But of course, insecurity across the country, especially in northern Nigeria, has worsened it because even, in those communities where most people are farmers, they're not able to go to their farms again, to harvest crops, and that obviously worsens their poverty level. It worsens their, purchasing power because they don't have money to purchase things, which goes back again to governance. Government must take into consideration this and provide some kind of social support to our people, to make sure that where at least women of childbearing age are able to eat the kind of foods that they require, so that when they get pregnant and when they give birth, they're also able to breastfeed and obviously cook nutritious meals for their children. But as a people, generally, we must begin to focus on using the locally available foods in our communities to prepare nutritious meals, because we have so many of these nutritious, foods in our communities. But in the process of preparing these foods, most of the time, nutrition is lost in the process. But basic things like exclusive breastfeeding for children is something that we need to advocate for, because if a child is exclusive breastfed, when you see that child, you see the difference between that child and one that is not exclusive breastfed. And the benefits of breastfeeding is also long-lasting. It actually lasts way into adulthood. And this is also supported by, by data and research.
So, Stanley?
For me, I agree with Dr. Nsofo. Governance and leadership, it begins and falls on governance and leadership. And the failures start from proper planning and prioritization. We have paid lip service to health. And even where we have paid any form of attention to health, it has been insufficient to follow through, because sometimes it just doesn't start on one day and end at the end of the year. It's a long process. You know, when you think about the children who suffer stunting, they are permanently the things you did over a period of 1,000, their first 1,000 days on earth damages them for the rest of their life. So it's the same challenge with governance and planning. A lot of the states are run on the whims and caprices of the governor, not based on proper data, proper planning, proper financing for all of these outcomes. So I think leadership will play a key role. And you will look at, when you look at the states where they have done better, go and look at the quality of service leadership that they have in those states. So leadership will be very critical. Leadership that will listen to advice and listen to experts will play a critical role in turning the tides. And I must say that, as Dr. Sofa highlighted, the impact of what we start today cannot even be felt, because those that are already damaged are damaged. So we're looking at saving people over in another 2-3 years if we pay concerted effort. And I think that leadership falls on state governors and local government officials. State governors especially, because we know that local governments are in their pockets. So where they show leadership, the local governments will follow. So we need to make sure, and especially because we're in an election year, and everybody's talking about presidential election without seeing how important the local elections, governorship, local government elections are to the outcomes around health, right? So the governors are fully responsible. Any role the federal government plays in primary health care is intervention. And it's important to highlight it, because, you know, somebody looks at these reports and say federal government has failed. The responsibility for solving this problem lies with state governments, and we must pay attention to what those running to be governors are saying with respect to things like health outcomes in their states. Planning is essential, leadership is essential, prioritization of primary health care is essential for us to get out of this place.
Especially against the backdrop that some of them who are running for offices as governors hardly know anything about the health sector, or do not have anything about health care delivery system in their programs and their manifestos.
And it is important for all. That is why conversations such as this is extremely important at this time, so that we can mobilize citizens to ask, how will you tackle health? Because you know when they make these promises, it's at very high level. I will support healthcare. How? The question we must ask throughout this election is, how will you tackle the challenges we have discussed today? Healthcare planning, tax shifting, minimum service, operationalization, legislation, policies. How will you can't come and promise I will improve health if you do not understand what the challenges are. So we must ask questions. We must let go of this gather people in the stadium and make noise and sing. We must say, show us how. I will deliver primary quality healthcare service delivery. How?
And then, of course, we go from there to interrogating that
plan. Let's start from show us how. Because at the moment, as you said, nobody says, they do not understand the challenges of these kind of things, malnutrition, stunting. They don't understand it, right? So let's get them to even say, I will try to solve this problem, and then we can then interrogate, how will you solve it? At the moment, nobody talks about stunting. I don't know if I follow the news as well. I can't remember anybody running for governor anywhere talking about solving challenges of stunting and malnutrition.
Not even the challenges of child and maternal mortality, which is a huge problem across Nigeria
That
today.
is where the challenge of all of this underweight, stunting, and all of this start from. If the maternal care provided at the primary health care centers are not sufficient for pregnant mothers to understand what it needs to even bring up the kids after childbirth, you've already laid the foundation for the problem. So, like you said, they're not paying attention, and it is our responsibility to make sure that this features prominently in a detailed format in this election.
It's good that this report is coming out at this time. Whether it's a coincidence or not is good, but it's a report that everyone needs to engage with. And I'm just wondering how one campaign, and indeed professionals like Dr. Nsofo, would make this report become a mainstream issue.
As an organization, we are talking, of course, this report is done in partnership with Nigeria Health Watch, National Advocates for Health, Public-Private Development Center. We received support from Africa Budget Network. We received support from World Bank and International Finance Corporation. Our hope beyond the launch is to carry out extensive advocacy, talk to political parties, not just to say, please include this. Do you want to work with us to include this in your manifesto? Do you want us to enlighten you on how to tackle some of these challenges? And we can bring in the experts to support the campaigns, to build the strategy on what they want to do. So we're not, again, like I said, we want to solve problems. We are not here to highlight what the problems are, right? But for campaigns, for states that are open to solving these problems, we are open for partnership to support you through the process. Again, we must lift people out of extreme poverty, and providing quality primary health care service is one of the building blocks for lifting people out of poverty. And whoever is open to finding solutions to the problem is a partner with us automatically.
Dr. Nsofo, before we go, let's ask you, how do we go about mainstreaming health care delivery into the governance system in Nigeria and sustaining it in such a way that, like Stanley said, helping to lift as many Nigerians as possible out of poverty?
Okay, so so I think, first of all, I mean, health is already in our constitution. It's on the concurrent list. So, so at least there's a legal backing for that. But obviously, we need people who are, vying for different political offices to know the right things to do. Even if they don't know the right things, they should be able to at least gather a team, that would advise. And I'm happy that Stanley has, mentioned that one campaign is open to this. But most importantly, we need to have an educated populace on healthcare issues. We need to have an active citizenship for health. This is something that Nigeria Health Watch does very well. Because there's so much that CSOs like Nigeria Health Watch and one campaign can do. We need our people to be incensed by this kind of report, the way they're incensed by, a poorly constructed road, for instance, or a bridge that is not constructed. Because I also think that as a people, we're part of the problem. If you see that's why politicians would rather do, these very gigantic projects and do it poorly, because they can come in front of it and take photos, because that's what our people want. We need to have an educated populace as far as healthcare is concerned that would demand and say, we need to have, the people, especially women of childbearing age and under 5 children, properly fed in our communities. What are your plans? I like the way that Stanley put it. What is the how? Don't confuse us with too much grammar. How are you going to go about this? I know, interestingly, the commonest cause of maternal mortality, for instance, is excessive bleeding after giving birth or during pregnancy.
Exactly.
And a woman who has poor nutrition, that is poorly fed, would suffer more from when she bleeds. Even if she bleeds little, she will suffer more of the consequences than a woman who is properly fed. Which shows you again that nutrition doesn't just kill under 5 and waste under 5 and make them stunted, but also kill women simply because they are trying to give birth. So our political class need to be properly informed. The law is there to back them up in what they have to do, but we need an educated populace who care about healthcare to push and demand that the right things have to be done and done properly.
Your last word here, Stanley.
The issues are clear, outlined in multiple reports, including the one we're launching tomorrow. The solutions are also obvious. And like you said, we need to mobilize attention to this issue, not in the form of high-level pronouncements, but in a detailed, clearly outlined plan that we all can contribute and follow up. Because for us as an organization, we are following up on a campaign we started to say, look, funding is a challenge for primary health care. We have got funding in the Basic Healthcare Provision Fund. We are following up on the utilization, and this is what the report aims to do, to say how are we utilizing it and what is the outcome of the funding we are using. So it's our collective responsibility to put pressure on our political leaders to pay attention to primary health care and also to sustain that attention, because once we take our pedal off this thing, they will also be distracted. So collective responsibility will get us there.
Community involvement.
Yes.
All right. Thank you so much, Stanley Achonu. He's country director, One Campaign. And of course, we were also joined by Dr. Ifeanyi Nsofo, Dr. Nsofo is a public health physician and senior New Voices Fellow at Aspen Institute in Washington, D.C. Thank you so much for your time and for bringing some new perspectives to this very critical issue. Health, they say, is wealth. And if we do not have health, we do not have wealth. And the poverty level will continue to grow. For a country that is regarded as the poverty capital of the world, we need good health to move ahead. Thank you so much, gentlemen. Thank you. And for you, our viewers, we thank you for investing your time with us. We hope that you have been sensitized enough to contribute to this enlightenment and the debate on good health care delivery for Nigeria. Where we are right now is not an enviable position at all. My name is Imoni Amarere. Bye for now.